Okay, we're going to go ahead and jump into the training. I'm going to act as if I'm tutoring or working with the client, and at the same time, I'm going to break away on occasion just to explain my rationale. So let's get started. You gave me as a warmer or a warm up. When do you usually go to the doctor? And so, as we approach this with the student, I would maybe go over some of the instances they say, and then we could discuss these terms here, what they're familiar with, and any other things that might arise. I'm sure that there are other things that I haven't noticed based on what I've provided here. Uh, I think this is a good follow-up question. Again, depending on their response, we can go a direction, or there are options there. So again, it's another opportunity to maybe introduce some terms or some vocabulary and clarify maybe some questions that they have as you go through. How do you prefer to set up your appointments? I think this is something that's very relevant nowadays. So with the student, we could talk about doing it by phone, and obviously that requires a higher level of understanding or comprehension than it does doing the appointment in person. Online's an option. Maybe they have someone else do it. I think these are all great follow-up questions to the initial question that you posed for me. And then I would present the situation. So they need a surgery in 2 weeks, like you had mentioned, and then the details. I just said that they need to have a mole removed from a region close to their eye, and their doctor recommended that they travel to Phoenix to see a renowned surgeon, Dr. Shankine. And so that's the situation. Then I would outline with them. So if you're the student, I'd say, okay, now that we know the situation, I'm going to model it for you. And then I'm going to give you an opportunity to discuss with me, and then you're going to have a chance to do the same. Here's what we need to do as we set up the appointment. We need to set it up with the receptionist. We need to give necessary information, such as insurance or medical background, and how to get that information to the receptionist. And then also we need to ask about the surgery itself, what will be required, how much time the patient will be out, and so all of that's important. Okay, and so break right there. Then I would go ahead and model it, and after I model the situation, let me go ahead and do that. So we'll do it by phone. Hello, my name's Jason, and I am Jason Anderton, and my doctor referred me to get a surgery through Dr. Shankine. She is one of the best in the world for the type of surgery that I need. What appointments do you have available here soon? Okay. Yeah, we were hoping within 2 weeks' time, if there are any openings. Hopefully there are. Okay, perfect. We'll take that one on Tuesday the 18th. Fantastic. Great. What information do you need from me? Okay. I will need to get you my insurance card information, the insurance company, the number or the membership number. Also, oh, you have a medical background paper that I need to fill out. Can you email me that information? Great. Fantastic. My email address is, okay, excellent. And then one more question. After the surgery, I guess prior to the surgery, before the surgery, and after, what will I need to expect? Okay. How long will the recovery be? Am I in the hospital? Oh, it's an outpatient surgery. So after I recover, I leave that day? Okay, that will help me when I prepare my travel plans to return back to my country. Excellent. Okay, thank you very much. Is there anything else that I need to do? Okay, I appreciate it. Thank you. All right, so that would be a simple model. And then at that point, we could discuss how that went. And then I'm going to give the student an opportunity to practice the situation with me. I would, of course, be the receptionist. The student would have the opportunity to practice. And then we could go right into feedback and see what areas that the student did well on, if there are any comprehension issues, and then just overall what went well and what could be improved upon and how it could be improved upon. Maybe there's a lack of vocabulary. Maybe there's some expressions, some of the grammar or syntax is shaky, and so we can dive into those specifics with the student and really raise the level of competence and confidence for the student. So that's how I would approach that. And then last of all, again, I don't know if your emphasis is on if you want a balanced approach of speaking and listening, writing and reading, but I did present this video here. This is a nice link that has it poses some of the questions of today as patients go and schedule their surgery. So it's a nice little 3-minute video that shows some options, and after that there could be some great follow-up questions concerning this whole process of setting a surgery, things to consider. I think it fits really well. So hopefully that gives you an overview or at least a feel of how I would approach this situation with a student. I understand that your company probably has some unique approaches that you pride yourself on, and I am more than willing to learn those approaches and to put emphasis where emphasis is due. But I thoroughly enjoy teaching and working one-on-one and with students, and so hopefully this gives you a better feel of where I'm coming from, and I would love to continue the conversation at a future date if you have any questions about some of the things that I've presented here today. Thank you very much for your time. I appreciate it.